Good afternoon and welcome to the teleconferencing session for the post-basic BSc nursing students of Indira Gandhi National Open University. We are going to have this teleconferencing session from 2:30 to 5 o'clock for the first year post-basic BSc nursing students, and I'm sure all of you who are attending the teleconference at various regional centers or study centers, you must have had some counseling sessions for the course on Nursing Foundation, Educational Psychology as well as on maternal nursing. So these are the three areas we are going to take today, but you can ask any other question related to nursing because you are just first year students and you have joined in the month of January. You must have finished a lot of your block theory classes and also first spell of practical. So there must be lot many questions in your mind. You are free to ask any time, and you will find our producers will roll down the telephone numbers. You can take help from our regional center, regional director or whoever is there in the regional center. They will facilitate you to call us. In case you can't contact us, you can always fax it and we will answer it back to you. May I request all the regional directors to kindly give us the attendance of students, because we need to maintain the record of how many students are attending today's teleconference. We have also sent a feedback performer, and please help the student to fill up that performer and send it back to us. Thank you. With this, I would like to introduce you to our experts. On my extreme right, we have Mrs. Annie Kumar, who is a senior faculty at Lady Hardinge Medical College, College of Nursing. It has just become a College of Nursing. Indeed, we are happy to have a fourth College of Nursing and third under Delhi University, and I am sure the students will get a lot of opportunity to interact with each other and get benefit from Mrs. Annie Kumar. On my immediate right, we have Mrs. Ravinder Kalra. She is under senior faculty at Rajkumari Amrit Kaur College of Nursing, University of Delhi. We are pleased to have you in the studio, and the topic what we are going to discuss under educational psychology, we thought there are certain theories which trouble you, and learning is one chapter which has got a lot of theories, and we thought it is better let us understand what learning is and what are the theories which help us to modify the behavior of an individual, behavior of a nurse colleague, and also behavior of the patient. Keeping that in mind, we thought we'll try to spend time only on a topic learning, but you're most welcome to ask any further question. Now, before we go into the total topic of learning, I thought let's see what is learning. How do we define learning?
Learning is it's quite a familiar term for all of you, and learning is defined as a permanent change in behavior that occurs as a result of experience or practice. Now, if you see to this definition, you have that it is the change in the behavior. The change in the behavior has to be permanent, not that it is there today and tomorrow you forget about it. When we say it is learning, it has to be a permanent change in the behavior that occurs with the practice or with the experience. That means when we are learning something, when there is some learning, some growth within us which helps us to learn certain things, that is by practice. Now, people grow, there is growth and development, that you increase in height, you increase in weight. That is not learning. That is just a process which is going to come even if you don't put in any efforts. But when it is learning, it has to be by practice or by experience. You read the things, you put in efforts, and you are able to learn. So these are the three characteristics of learning. Now, there are,
for example, a student who learns how to give intramuscular injection, you remember the days. Now, learning, we didn't say that you have learned until and unless you had practiced intramuscular injection. Number of times you had practiced, and it so happened now, suppose you have to give intramuscular injection at home, you immediately remove your jewelry and go and wash your hands and use the spirit swab. If spirit is not available, you use Dettol, and even if that is not available, sometimes you ask, do you have aftershave solution? I have seen many a times these kind of thing which cleans the area, and then you give the injection and immediately you go and wash hands. Now, nobody has to tell you, because it has changed your behavior in terms of how to maintain the aseptic technique no matter wherever you are, whether you are in a home setting, in emergency setting. So we say that learning has taken place because of the practice, the skill has been developed. Now, sometimes we create a condition, we create a situation by which the learning takes place, and that's what is called as conditioning. Now,
Yeah.
would you like to elaborate what is conditioning further?
Yes. Now, if we see to conditioning, there are different types of learning, and most of the theories of learning, they are based on that there is a stimulus and there is a response. Like you have the demonstration of, like Madam was giving the example of injection giving. You have the demonstration of injection giving and a person learns it. There is a stimulus and there is a response to it. Now, the classical learning and operant conditioning, they are the stimulus response theories. But then there are certain people who argue that it is not only that you always learn because of the stimulus and response. Many times it is that you perceive certain things from environment, there is a perception, and you use your intelligence in understanding those things, and then only you are able to pick up those things. So those types of learnings are like which come under cognitive learning. When we say conditioning, conditioning is a term which is used to describe a process by which a neutral stimulus gains the power to elicit conditioned response. That means, if suppose that was shown by Pavlov in an experiment, that he was presenting food and there is a normal response that seeing to the food, the dog will have the salivation. And before the food was being presented, he would ring the bell. Gradually, the conditioning occurred. That means, along with, as soon as the bell rang, the dog started salivation. That means, this bell became a conditioned stimulus and salivation was a conditioned response. Whereas food is unconditional stimulus for which there is unconditional response, that is salivation. Seeing to the food, it is natural that a dog is going to have salivation. But because every time the bell was there, after which the food was presented, so the dog learned that after the bell, the food is going to come and salivation would start as soon as the bell was ringing. So this is what is classical conditioning, where conditioned stimulus creates conditioned response. That means bell is able to produce salivation in a dog. This type of conditioning is classical conditioning.
And many times this kind of example you can use in little children, you know, when you want to feed them or when you want mom has come at home, you know, the knock at the door makes the child run. No, so these kind of things also can be related to the growth and development of children and teaching them certain positive way of stimuli. To begin with, of course, later on with understanding, with use of judgmental abilities, intelligence, the children are able to learn, you know, cognitive learning takes place. But to begin with, for example, you know, if you want to tell to a child not to touch something which is hot, you know, anything which is hot, you say it's hot, it's hot. So the child understands there's something wrong which I'm not supposed to touch. So anything which is related to that, the child says hot, hot, you know, child understand it's because it is hot, mother or father are saying not to touch it, you know. So that's a sort of a learning which takes place, and that's how, you know, you teach in the beginning to the patients also. It's like for CVA patient. You know, you tell the patient to swallow, you demonstrate that. Food and then swallow. You know, these are some of the things which we try to relate it in nursing, because not that this person does not know how to swallow. I remember a case where the person was not able to walk after being in plaster for 5-6 months. And you know, the person was to be demonstrated and would stand up. The moment this particular physiotherapist will come, immediately the reaction of the person will be to get tense and to see how she had to get up. So presence of physiotherapist was sort of a conditional stimulus.
Another example we can just think of is that usually when a child is given an injection, the response is the child is going to cry. But when the child learns that yes, anybody who is coming in uniform, the nursing uniform, the child is going to get a prick. And gradually, as soon as the child sees a nurse, starts crying. So that means that has been unconditioned stimulus. Injection which produces an unconditioned response of crying. But the conditioned stimulus, that is the nurse in uniform started producing the conditioned response, that is the child to cry, because the child is able to learn that this means that the child is going to get a prick. So that's another example. Now there are certain terminologies in classical conditioning what you need to learn, like acquisition. When we say acquisition, that means the each paired presentation of conditioned stimulus and unconditioned stimulus should be presented a number of times, and the interval between conditioned stimulus and unconditioned stimulus should be short. That means there has to be very less time between bell and food. Not that the bell was rang and after 10 minutes you are bringing the food, but it has to be followed within a short gap. Then only there will be acquisition. That means the conditioned stimulus will be able to produce the conditioned response. The stimulus stimulation substitution is another word. Stimulus substitution is that with conditioning, a bond is formed between conditioned stimulus and unconditioned stimulus, and as a result of this, bell becomes equivalent to food. That means with bell there is salivation, and this is called stimulus substitution. That means what work was to be done by food is being done by bell. That is stimulus substitution. Injection prick, that same response the child gets when there is presence of nurse. So this is stimulus substitution. That means the child starts feeling the pain just by seeing the nurse. And next is stimulus generalization and discrimination. Stimulus generalization, give very simple example that one particular nurse is giving injection, but later on the child sees that anybody coming in uniform, the child starts crying. So that is stimulus generalization. That means if suppose the sound of the bell was little different also, still the dog was able to have salivation. That means little bit change in the stimulus also produced the same response. That is stimulus generalization. Stimulus discrimination is that one is able to make out that yes, this is the particular nurse who is giving injection, but other nurses are not giving the injection. So the child starts seeing that particular nurse only who is giving injection every day. That is stimulus discrimination. Then another is extinction and spontaneous recovery. In case you are not presenting food, the bell rings, the food is not served, for some time the dog is going to have salivation, but later on there is extinction. That means many times you have not given the food but only bell, there will be no response, no conditioned response produced because of conditioned stimulus, that is bell. Spontaneous recovery is, but as soon as you start giving the food, holding the bell, the dog is going to start salivation. Then you don't have to put in that much effort. It will be spontaneous recovery which is going to occur. So these are some of the terms which are associated with classical conditioning.
So classical conditioning is one way by which a person can learn. Learning takes place. It depends upon what kind of learning, at what stage the learning has to take place, and who has to be taught and who has to learn. So that's what is very significant. But Skinner has also described an operant conditioning. Now what is that operant conditioning, Mrs. Kumar?
Operant conditioning is another approach to learning. It means the likelihood of a behavior depends on the significance of the event immediately following it.
Okay.
For example, if the event is positively reinforced or rewarded, then there will be chances that it will recur in the future. And also if it is not reinforced, or if it is negatively reinforced or punished, then there are less recurrences, or the event will stop completely, which is known as extinction. An alternative approach is known as stimulus control. It means a stimulus changes the event preceding it. It can also be known as instrumental learning. It means when some action or some behavior of the learner is instrumental in bringing about a change in the environment, which will make the action to occur or to stop completely. For example, putting food in your mouth, it has a pleasant consequence that you enjoy the taste and you enjoy the feeling. So there are chances that you will, whenever you see the food, you will open the mouth and you will put the food inside the mouth. So it can be explained as behavior. If the positive consequence is there, then there are chances that the behavior will recur or happen again in the future. And if the behavior is followed by a negative consequence or some sort of punishment, then the behavior disappears or the extinction takes place. This type of learning is used to teach new behaviors to humans and also to animals. The basics are reinforcement or punishment. In children, we usually use this type of learning, like there can be positive reinforcements in the form of rewards, in the form of sweets, in the form of money, some gifts you are giving to exhibit a positive behavior or a wanted behavior. Same way, you can negatively reinforce the child by giving punishment or by not showing love, affection whenever he shows a negative behavior which is unwanted in the child. So the basic principle of operant conditioning is reinforcement. It means when a behavior occurs which is followed by a positive reinforcement, it will occur again in the future. For example, you have taken up BSc nursing. Why? Because you are positively reinforced by calling you as a graduate, or you are monetarily benefited, or there will be praises. Okay, you are done diploma and you are going through all the difficulties, because you will be rewarded with monetary benefits also, and you will be given a degree at the end of the course. So that is reinforcement or positive reinforcement. Then the nature of reinforcement, that is positive and negative, the nature depends on the effect it has on the behavior. For example, what may be positively reinforcing to some people may be negatively reinforcing for other people. For example, food is a positive reinforcement for many people, like they want some sweets, they want some kind of food which can be acted as a positive reinforcement. But to an anorexic girl, it will act as a negative reinforcement. So before providing the positive or negative, you should see the nature by which the person will accept it. Then the strength and the direction of reinforcement also depend on the child's relationship. For example, if the child will be positively reinforced if he is involved with a football game in which his father is involved rather mother, because father figure is more connected with the game of football. Then the types of reinforcement. The types of reinforcement can be primary and secondary. The primary reinforcement means the material rewards like sweets, food, gifts, prizes, etc. Secondary or social rewards means praise, smile, which will benefit or which will encourage the child to exhibit the behavior again and again. Events which strengthen the behavior is positive reinforcement, and which will cause termination is negative reinforcement. Then coming to the schedule of reinforcement, according to Skinner, he says at the beginning each event should be positively reinforced. Like then only the child will be motivated to redo it or to do it again and again in the future. And it should be continued. Like every time the child should be reinforced. Then after a while, when the child is exhibiting or you are exhibiting the positive behavior, then you can give the reinforcement in the intervals. Like every third event or the third response can be given positive reinforcement, then you can shift it to the every 10th response can be reinforced, so that the child will learn to show the positive behavior. For example, he is saying you should not schedule it in a regular interval. It is explained by fixed ratio reinforcement. Like the interval between the response and the reward will be equal, then the child or the person who is undergoing this learning process, he will expect every fifth response will be rewarded. So he will show the positive behavior for his fifth action. So it should not be on a regular ratio. For example, for 100 responses, you should randomly reinforce the behavior. So you can expect a constant, fairly pace of positive behavior in the person.
So I think this is also important in nursing. Like first year students or first year post basic BSc nursing students, when they join, they are very apprehensive about the whole program, how will they learn on their own, and then so much of a clinical aid, clinical work is there which they have to do independently and which they have to do under the supervision of teachers. And they themselves are very senior students. You sometimes must be feeling that. But remember, to be a student is student at any age, and that is why your teachers keep saying, don't worry, this will happen, you will be able to do it, come, you can ring us up, or you can even ask your senior students. So these are some type of positive reinforcers. It's like, a first year DNM or BSc nurse joins. A first year teacher is supposed to be a senior teacher. You will find in all schools of nursing, in colleges of nursing, it is thought that first year teacher should be a very senior teacher. I mean, that is a principle which is kept in mind. The reason is that she or he could give lots of example and give a positive reinforcement to the student to understand that the nursing is what you thought. You may not be having an idea, or many of them, they have idea, but when they actually become a student, they really get surprised what they have got entered into, where they require a lot of counseling, lot of positive strokes, to understand what they are doing is proper or not, So they have to make a decision in first year itself. So these positive reinforcement helps them to see the brighter side of the profession which they have joined. I was just coming across a child who is really in a conflicting situation which profession to choose, because he's a bright child, a topper in all the things, and it's a conflicting situation for a child. But whatever the child chooses, the positive reinforcement would help him or her to maintain the balance of his mental health and will be able to learn better. So I think this is what the positive reinforcement is significant.
Yes.
Regarding the extinction, even in nursing, when a student is not able to maintain an aseptic technique,
Yes.
most of the time the teacher will keep looking through the glasses or will keep looking from other cabins whether the student is maintaining the aseptic technique or not. When the evaluation is being given, the student is explained at what level the aseptic technique was not maintained, and then is given a time that after 3 weeks again we'll make the observation. So the student has to extinct that feeling, behavior that I cannot do without maintaining the aseptic technique for the procedures where the patient may get infection or she herself may get infection. So these are some of the examples I thought I could share.
Yes,
Yes, please.
And one more example is when the students are appearing for examination. For example, you have given some writing assignment to the students. Then they have written something on their hands or some paper, and they have copied it, and the teacher has found it out. In front of the other students, the teacher is condemning the child or the student and saying, why did you do this, and your insincerity is showing through this behavior, and the student understands that it was wrong, and the teacher is saying, look at the other guests, and they are given praise that with their sincerity they have appeared well in the exam, and it is not the marks it is counted but your sincerity. So that way the praise is given to the other students as a positive reinforcement. And failure or the teacher is condemning the student, that becomes a negative reinforcement or sort of punishment to the student. Then to eliminate unacceptable behavior, punishment is used. Nowadays there are physical punishments also given to the students, but nowadays you can see in the papers that it is banned by law also, that caning or physical punishment should be avoided in the children as well as in the students. And we can use negative emotional states like anxiety, expression of sense of failure, etc. as more effective to act as negative reinforcements or punishments. So punishment decreases the frequency of a behavior and stops the behavior. Then these methods of reinforcing positively and negatively are found very effective in modifying the behavior of people like children, adults, and these are used in students also.
So we have learnt about classical conditioning and operant conditioning. Do you have any question to ask? Any of the center, please, if you have any question. Last time Delhi wanted to get in touch with us but could not get through. If the students are sitting in Delhi Regional Center, please help them to ask the questions. Any of the regional center, please give us the attendance also so that we know students are listening to us. Well, we have talked about the classical conditioning which helps in learning, and operant conditioning. Some of the differences we have seen, but what are the more specific difference between classical conditioning and operant conditioning? Mrs. Kal.
We can just go through the differences between classical conditioning and operant conditioning. As we said that in classical conditioning there is an unconditioned stimulus which produces unconditioned response. But with the presentation, it is conditioned stimulus which is producing conditioned response. So if we see to the differences, first of all is that unconditional stimulus is given irrespective of organism's behavior. That means we don't expect that the dog will start the salivation on hearing the bell. But every time after bell, the food is being followed. So irrespective of the presence of salivation on ringing up of the bell, the dog is being given food. Whereas in case of operant conditioning, the organism's own behavior determines whether or not the unconditioned stimulus will be presented. Unconditioned stimulus will be presented or not, that will depend upon, like if the child has worked well, done the work nicely, the child will get the reward, maybe in some materialistic form or in the form of appreciation. Classical condition, the time interval between conditioned stimulus and unconditioned stimulus is rigidly fixed. You have a fixed time gap between the ringing up of the bell and food. We said if there is a long gap, then maybe the conditioned response may not be there to conditioned stimulus. But in case of operant conditioning, the interval will depend on organism's own behavior. How frequently you are showing a particular behavior, then only you will be rewarded or you will be punished for that. In case of classical conditioning, the unconditioned stimulus occurs without regard to the subject's behavior. That means it's not the dog started salivation on the bell and then food was presented, but there was unconditioned stimulus without regard to the behavior. Food was being given after the bell rings. Whereas in case of operant condition, the reward is contingent upon occurrence of response. Only if a particular behavior is shown, that person will be rewarded or punished. Next is association between stimulus response is on the basis of law of contiguity. That means things occurring closer in time and space get associated. If there is less time gap between the bell and the food, then only it will get association. Not that 1 hour before the bell is ringing and the food is presented after 1 hour, then the dog will not have salivation on ringing up of the bell. Whereas in case of operant conditioning, association between stimulus response is on the basis of law of effect. That means effect of punishment and reward. If the child is appreciated for a particular thing, then the child is going to have repetition of behavior. The child will be showing the behavior again and again. If the child gets punishment for a particular thing, then it will not be repeated. Then next is time is there is pairing of unconditioned stimulus and conditioned stimulus. Whereas in operant condition there is no pairing of unconditioned stimulus and conditioned stimulus, but there is response and reinforcing stimulus which follow. That means the child has shown or the person has shown certain behavior and this is followed by reinforcer, which can be positive reinforcer or negative reinforcer. Next is reinforcement comes first as food is presented first to elicit the response. Whereas in operant conditioning, the reinforcement is provided only after the response is made. You are going to get the monetary benefit only after you complete your BSc. Next is stress is laid on time control. That means we talked earlier also that there has to be less time period between the conditioned stimulus and unconditioned stimulus. Whereas in operant condition, place of motivation and reward is stressed. Like madam was giving earlier also example that you have to have the reward which is of value to the person. If to an anorexic patient you offer food as a reward, that will not be taken as a reward. Next is the essence of learning is stimulus substitution. That means as a result of that learning, the stimulus substitution which we talked earlier, like the bell having salivation, that is stimulus substitution takes place. Whereas in case of operant conditioning, the essence of learning is response modification. That means you want to have a particular behavior being shown, and that you are strengthening by giving reward, or you are trying to decrease a particular behavior by punishing the person. Then in case of classical conditioning, this is stimulus oriented, whereas operant conditioning, it is response oriented. That means if response is going to be there, then the behavior will be strengthened. Whereas in case of classical conditioning, it is stimulus which produces the response.
And
so these are the major
differences. And I think this is what is very important, that one is a response oriented kind of a operant conditioning. Skinner has talked about the behavior modification because of the responses, whereas the Pavlov has talked about more of a scientific or stimulus related response. Well, we have talked about the classical conditioning and learning, we have talked about operant conditioning and learning, and we were mentioning about cognitive learning. Now what is this cognitive learning? How do we explain this, Mrs. Kumar?
Okay. Cognition means the act or process of knowing. It is required by getting information processed on or as a result of experiences a person has had. In learning more complex forms, cognitive process play an important role. For example, by perceiving, by knowing, by reasoning, we learn. That is known as cognitive learning. Cognitive theories say that learning cannot be explained by stimulus-response association. They believe that learner makes cognitive structure in the memory. Like they are making some understanding in the memory. Then the information is getting related to some relationships which you have already had. Then they form a meaning. That is how they learn. Without any non-reinforcement, new associations are formed. The types of cognitive learning are insight learning. Insight learning is explained by German psychologist Kohler. He is saying while working on a problem, one does it through insight and not by merely trial and error method. Insight means perceiving, understanding the relationships essential for a solution. It is explained by Kohler by an experiment, like he has kept a chimpanzee in a barred cage, and he has given two unequal sticks to the chimpanzee. He tried with both the stick, and one fruit was kept outside the cage, and the chimpanzee tried with both the sticks to get the fruit, but he later on used his insight learning, joined the two sticks and tried for the fruit, and he got the fruit. So it is explained by insight learning. So insight is often used in problem solving methods, in solving puzzles, riddles, etc. It is also known as aha experience because we use a sudden approach to solution of the problem. The next type of learning is sign learning. It means one stimulus is followed by another in a particular context. It means what we learn is a set of expectations and what we expect or understand from the environment. This is developed by Tolman. He says we learn on the basis of understanding and making relationship with the stimulus. Then latent learning. Latent learning means the learning which comes evident only when the occasion for using it arises. Like you are not using it at the time of learning, but whenever the occasion arises, you get to use that type or that skill. Many times you learn many things, but you are not able or you are not using it at the time of learning. But it is in you, and whenever the occasion arises, you use the skill or you use the knowledge. That is latent.
It's like somebody had told, that she had in nursing arts, in fundamental of nursing, we used to practice that 3-bottle suction method.
Yes.
So she said, this is many years back, 20 years back, when there was, even more than that, 30 years back, when we had to really depend upon these kind of technology in the hospitals. And she was working in West Bengal, and the patient was having, distension of abdomen, severe distension after the surgery, and she said that I told the doctor, and they were saying, oh, we wish we had suction apparatus, and it was a very low thermal suction apparatus which was available, and she said, okay, doesn't matter, I had learnt in nursing arts, and we will practice that. And they started practicing, and after that it became a routine that for every patient going through the surgery, that's a latent learning. You had learned once upon a time, but you are able to use it, you are able to recall it and use it in a very scientific manner. That becomes latent learning. Am I right in explaining that? Okay. So I think we have talked about the cognitive learning, because all of us, we kept on insisting that it is not always a conditioned learning, classical conditioning or a operant learning. But there is something called social learning. Children learn, like I was telling, how children learn from parents. So there is a social learning also. Would you like to explain?
It is usually said that most of the learning is not through the classroom and not through what is being read in the book, but most of the learning is what we observe. Child also picks up many things which may not be through formal learning in the classroom or in other things, but how the parents are behaving. The child learns that type of a behavior. Maybe you are shouting and you find that next day your child also shouting same way. And then you are surprised, how can the child use certain, such type of language without realizing that you had been the role model for that. That type of learning is social learning. Even in our nursing also, when we are having a practical experience, you have your supervisor going with you in your clinical area, you pick up many things from the supervisor, that how the way she dresses up, the way she walks around in the ward, the way she efficiently moves from one work to another work, and the way she organizes her work. If suppose you have a role model who is able to develop good IPR with the patient, good interpersonal relationship, you also try to see how much patients they respect her, or how much she is able to give to the care to the patients, how much they feel confident on her, and you also start picking up the same thing. There is modeling which happens, that means the supervisor acts as a role model and you pick up those things. It is not only that good things only we pick up, but many times if you have a person, like many times you have that impression that staff nurses are very rude. Maybe in special settings where you are under a lot of stress, maybe you're working in ICUs in other places and relatives keep coming and troubling you all the time, asking about the condition of the patient, that you would like to see the patient and they don't want to follow the restricted hours, and the staff nurse is shouting. And similarly the others also who see, the junior nurses also start picking up that type of behavior for them. So social learning can be for the positive behavior and can be for the negative thing.
Also I feel, sometimes when the staff nurses under stress speaks loudly to the patients, the other nurses sometimes pick up and say that no matter how much stress I would have, I will not speak loudly. So that's also a learning that maybe in this particular stressful situation, this nurse gets quite apprehensive because the pressure of work is quite a lot, number of nurses are less, patients are very serious, and everybody wants to attend to patient and see that the patient recovers, but that cool needs to be maintained by the nursing professional or by the medical team, because patients are only looking at the nurses and the medical team to know how their relative is. So maybe the other nurse says that I will never do this, I think most of the time, many of the times, the teachers who gets angry with the students, the students sometimes say, if I become teacher, I will see that the students are not indisciplined, but I will not get angry like this, So there is a both way of social learning. I think you learn from the positive points and you learn from the negative points also. So I think that's very interesting, that how we learn from the role models and how we learn from the teachers. And that is why it is expected that the senior nursing personnel, senior teachers should behave in such a maturity so that you become a role model. Why it is said that the uniform worn by the nursing superintendent or by the senior nurse in the ward or by the teacher becomes a model for the junior or for the youngsters, and how it is to be taken care of, So these are what is called as social learning, which is not to be propagated, but there is somebody to whom you look upon, and then you start working. And in nursing, I think it is quite a lot, If the patient is in a distress, and if the teacher is seen it, no matter how busy she is, or a senior nurse has seen the patient in distress, teacher walks quickly and then puts the patient in a propped up position, helps the attendant to get an oxygen cylinder, gives the oxygen to the patient, and then tells the student that here is a problem, take care of the student, and student thinks, oh my lord, this is what my teacher has done, and I have to be alert and active like this, So that's part of social learning. Let's quickly go through that. What is the significance of learning in nursing? I mean, we have given a couple of examples that, and how can you make learning very effective? Just few examples, as we are running short of time.
There are certain tips to make your learning effective. One is that you have a definite goal. If you know that what you want to achieve, you have a very specific goal, then it becomes easy. Next is that knowledge of results and psychological feedback. When you know that yes, if after BSc I am going to get this benefit, I am going to get monetary benefit, I am going to get another benefits, I will be a graduate, you have a better learning. Then distribution of practice periods. You cannot sit, if you plan to sit for 6 hours and 7 hours, it might be very difficult. But if you plan that I'll sit for 45 minutes and then have break for 15 minutes or 10 minutes or 5 minutes, then it becomes easy. Whole versus part method, when we say it is that for easy things, you can read everything at a stretch. But when it is some difficult portion to be studied and you try to complete everything within one sitting, it might be difficult. So for such things, you should always divide it into parts, that yes, I'm going to divide it into 5 parts, and one part I'm going to read, I'll take a break for 5 minutes. Then again I'll sit, I'll again take a break. That is going to help. Logical learning. It's not that you have to, just read and learn everything that way, but you have to try to understand the meaning, you have to try to understand and then learn. Then there's logical, that's logical learning. You cannot, keep learning in that way. You have to be logical in your reasoning and then learn. Rhyming also helps, that you try to maybe, you have to remember certain words and you try to remember the first letter of each word, give some word to the total points, and you are able to learn better.
Can you just tell us, Ms. Kumar, what is the significance? Of course, we have learned in nursing giving examples, just 1 or 2 good examples.
Learning is used for development and modification of behavior in the patients. In the clinical area you can use it, and also in your academical process you can use it. And so many treatments are based on these theories. Like when you treat the psychiatric patients, you will come to know that you apply behavioral therapy, you apply cognitive therapy, depending on these theories of learning. Then the transfer of learning is also applied in nursing. Like when you start with teaching, in the first year you are learning psychology. In the second year you are learning psychiatry, because many theories and many aspects in the psychology is used or transferred in the learning of psychiatry.
It's like anatomy, physiology. When you are learning in first year, you continue it throughout, whether you've done master's, PhD, so that it is applied. Well, thank you so much. We have discussed about learning. We did discuss about what is classical conditioning and what is operant conditioning and how people learn. I think the experts very nicely explained about the cognitive learning and social learning and what is the significance of learning for nursing personnel. I think there were many good examples which you must have heard, but we have not heard from any of the regional directors about the number of students attending today's teleconference. With this, I would like to thank Ms. Adikar and Mrs. Kalra for being with us today in the afternoon. Please stay with us. We'll be back at 3:30 and we'll have a teleconferencing session about maternal nursing.